A new study by Intermountain Medical Center finds a link between stroke medication and developing dementia. They say it boils down to blood-thinning medications that stroke patients use to limit their chances of having another one. But improper doses for an extended period of time could affect a patient's cognitive skills. In our continued partnership with Intermountain Medical Center, we find out what this means for a growing number of Americans.
Atrial fibrillation is a fast, chaotic rhythm of the upper chambers of the heart.
A condition that affects about 10% of Americans.
This chaotic, fast rhythm of the upper chambers of the heart would speed up, and he would develop an acute dementia or cognitive decline.
Intermountain Medical Center Heart Institute Dr. Jared Bunch says finding this link gives them more insight about treatment and prevention.
So when somebody's diagnosed with dementia, it's already very significantly impact their quality of life.
People over the age of 60 or people who are overweight or obese are more susceptible to getting atrial fibrillation. But it's people on the other end of the spectrum too, endurance athletes.
The lower your resting heart rate, the more races you participate in a year, and the faster you participate in the races. So essentially it's the most fit of the endurance athletes that are the highest risk.
You'll remember Ashley Irvin. She had a stroke at the age of 23 after spending much of her life training on a soccer field.
I got this overwhelming feeling of like I'm tired, fatigue, you know, and so I put my left hand to my forehead, and my mom was like, she said, does she always do this, to my husband that was sitting on my right side, and he's like, no, not really, and that's when I can't really remember what happened to me.
Now Ashley takes medication to reduce her chances of having another stroke. Warfarin is commonly used to prevent blood clots in atrial fibrillation patients, but improperly dosed, that could lead to dementia and other complications.
You have to have your blood checked at regular intervals to dose it. It interacts with many of the foods we take.
Now that IMC doctors found this link, that will help them prevent dementia and extend a patient's life. And while 10% of Americans have the condition, your chances of getting it greatly increases with family history. That's why Intermountain Medical Center Heart Institute's research continues.
Good to know there.
Yeah, got to figure it out.